Hello everyone, I am Jansi, working as a clinical instructor at Tripling College of Nursing. I'm going to take you to the topic Venepuncture. Let us see the learning outcomes of the Venepuncture. So the learners will be able to define Venepuncture and list the indications of Venepuncture, explain the commonly used sites, and list the inappropriate veins, and will be able to explain the procedure in detail and will also be able to discuss the risk and complications of venipuncture. So what is venipuncture? Venipuncture is a routine invasive procedure that involves puncturing a vein with a needle to gain venous access, either for phlebotomy, that is the collection of blood, or for the intravenous therapy. Typically, venipuncture is used to retrieve a blood sample for laboratory testing, but it can also be used for donations or therapeutic reasons. So let's see what are the indications. So first thing is to retrieve a blood sample for diagnostic reasons. Next, to assess the level of blood components. It is also helpful to give IV therapy. For example, medicines, nutrition, and chemo drugs can be given through the site. It can also help to treat conditions such as hemochromatosis, polycythemia vera, sickle cell disease, and non-alcoholic fatty liver disease. Can also collect blood for later use, for example, transfusions. The commonly used veins are basilic and cephalic veins in the forearm, median cubital and cephalic basilic veins, which is in the antecubital fossa, radial vein in the radial area, dorsal metacarpal vein in the hand, veins in the foot, femoral and saphenous veins in the thigh, and veins in the scalp for infants. Yes, these are the veins. So this is the cephalic vein. This is the basilic vein. And this is the dorsovenous arch, which we are not supposed to puncture in. So this is the cephalic vein. This is the radial vein. This is the antecubital space. And this is the median cephalic vein. Here is the axillary, and this roots down to the basilic vein, and then to the median basilic vein, and then median cubital vein. So, choosing a vein. How to choose a vein? It should be easily accessible first, and always prefer an unused vein. Next, it should be easily detected, and it should also appear healthy and patent. The most prominent vein is not necessarily the most suitable vein. There's a saying, the most prominent vein is not necessarily to be the most suitable vein. Okay, let's see what are the inappropriate sites that is to be avoided. First thing is burn. Thrombused vein. Already in a hand, if there is any blood transfusion going on, avoid that vein too. If a hand is having hematoma, that should be avoided. A hand already the IV therapy is on flow, avoid that site too. And the hand with fistula and filled with edema. These are the sites which is to be avoided. Okay, now let's see how to perform a venipuncture. Let's see the procedure. First thing is to organize. So organize all the required articles. Second thing, confirm. So confirm the patient's identity. and explain the procedure to the patient. Third, ask. So ask the patient if they have any allergies or phobias or have ever fainted from injections in the past so that you can make an appropriate arrangements. Next, choose an arm. Choose the most appropriate arm for insertion and apply tourniquet. So the tourniquet should be left for no longer than 2 minutes in an arm. Position. So choose the most appropriate arm for insertion and apply the tourniquet. Next, position the patient's arm downwards. Position the patient's arm downwards. Next, choose the vein. So identify the vein. This is the most appropriate puncture site. So the vein chosen should be large, visible, straight, and clear. Next, perform. Perform hand hygiene and don non-sterile gloves. Next, cleanse. Cleanse the chosen puncture site and allow it to dry. I repeat, cleanse the chosen puncture site and allow it to dry. Next, stabilize. Hold the patient's arm and place your thumb below the chosen site, puncture site to stabilize the vein. Next, ask the patient to form a fist to make vein more visible. Next is inform. What are you going to inform the patient? So inform the patient that you are intending to puncture the chosen site prior to your insertion of the needle. Next, enter. Enter the vein from above or the side of the site. You should puncture the vein at 15 to 30-degree angle with the bevel facing upwards. So slightly decrease the angle of the needle once you have entered the vein and insert a fraction further. So don't try to manipulate the needle. Attempt. So next, if there is no blood return, you can always release the tourniquet and then reattempt the site one more time. Next is to attach. Attach. Attach the designated blood transfer device to collect the blood sample. Next, the tourniquet can be loosened slightly during blood collection itself. 16. Follow. What are you supposed to follow? Follow the correct order of draw to avoid contamination of additives. Next, apply pressure. Once the collection has been over or completed, then release the pressure of the tourniquet and then completely remove the needle after applying pressure. Next thing is to discard. Once the blood collection has been completed, you are supposed to discard all the articles which is used. So apply pressure to the puncture site until the bleeding stops and the patient's arm is straight. After that, label it. Label the blood samples as required. Remove gloves and perform hand hygiene. Next, monitor. So here you will monitor the patient for a few minutes after the procedure and inspect the venipuncture site for bleeding. Provide aftercare advice. So then you will have to sit the patient up slowly and ask how they are feeling before the patient leaves or before the patient is going to do other activity. So discard all the waste and clean the equipments which is required to be cleaned. After performing your hand hygiene, make sure that you document the procedure. Document it with date, number of attempts, time, and in which site you had punctured. These things to be kept in mind. Note, puncture the vein at only 15 to 30-degree angle with the bevel facing upwards. Next, moving on to the risks and complications. So, it is again further classified into two categories, risk to the client and risk to the staff. So, when it comes to the risk to the client, pain and bruising. You may cause pain or bruising in the hand by puncturing it. Nerve damage can happen, hematoma, injury to the anatomical structures, and there can be a high chance of bacterial infection at the punctured site. Okay, let's see what are the risks for the staff. Staff is getting exposed to bloodborne pathogens such as HIV, syphilis, or malaria. And there is a high chance for the staff for sharp injuries and hepatitis B. Question. Okay, how many venipuncture attempts can be made at any one given time? 1, 2, 3, 4, or more? Yes, you're not supposed to make more than 2 attempts at one time. Make sure that you don't puncture beyond 2 times. I would like to conclude my topic. So far, we had discussed about the venipuncture, its definition, sites, inappropriate sites, the procedure, and also the risks and complications. Hope everybody understood. The more relaxed and trusting your patient, the greater chance of successful atraumatic venipuncture. So hand movement of the practitioner is adjusted according to blood flow. This can be made. These are the references I had used. Thank you.